Good day, everyone. Thank you once again for joining Charms MediHelps Foundation in its first annual Black History Month event. It's a monthly event and it's all about the community that means the most to me, which is the Black African American community. We've actually had so far, we've had 23 days of blessed conversation, and we are now going to start. It always takes a second or two to actually go live with StreamYard and LinkedIn, but we're live right now. We do have our guest with us, Tracy Thornton Wesley. As out of respect to her, we will be hearing from her. We won't see her, but we will be hearing from her. This is her first time, or her second time speaking loud, doing public speaking on this topic. And so if you can welcome her with love, that would be great. If you're on Facebook and you're watching, please put your comments in Facebook so that she can address them. If you're on LinkedIn, please put your comments in LinkedIn so that she can address them as well. If you have comments or you have questions, please go ahead. In the allotted time that we will try to, once again, the most important thing is being educated. So we're going to let Tracy have her time in educating us. But towards the end, if you have comments they will be answered. Whether they're answered tonight or whether they're answered through a comment that you put in the chat on Facebook or on LinkedIn, they will be answered. Please note once again, this event is available for you. So should you find yourself in need of listening to a senior subject matter expert talk on a subject matter which is diabetes, which impacts not just the African American community, but we have a special affinity for for diabetes, meaning that there are an outstanding amount of African Americans who have been diagnosed with diabetes that it belongs. I don't want to say it belongs to us, but what I do want to say is that it's important for us to hear about the negative impact. So if you want the link and you want to share it with someone, please go ahead and contact me and say, Sandra, can I have the link? If you want to contact Tracy at the end, please send me some information saying I want to talk to Tracy, I want to interview her, or I just want her to speak to me. Please go ahead and let me know, because Charms MediHelps Foundation, what we did design these programs to do and these events to do is to educate. And so while an hour is, we're doing an injustice of giving these topics an hour, we want you to all know that these speakers are available for longer lengths of time should you need them to speak to you or to your organization. So please, by all means, reach out. Today's our honored guest is Mrs. Tracy Thornton Wesley. She is an accomplished professional with over 29 years of experience as a registered professional nurse. Throughout her extensive career, Tracy has demonstrated a deep commitment to providing compassionate and high quality care to patients. In addition to her nursing expertise, Tracy is also a seasoned real estate investor, leveraging her financial acumen to navigate the complexities of the real estate market and build a successful investment portfolio. As a passionate advocate for health, education, and community empowerment, Tracy recently made her mark as a debut author with the publication of two impactful books. One is Living Better with Diabetes. I think I'm going to stop here for a second because I put up a quote. What I've been trying to do throughout the 30 days is put up a quote that speaks to the importance of the speakers that come on. And I put up the quote yesterday in reference to Tracy's, where Della Reese is quoted as saying diabetes is not the end of your life, especially if you learn how to live healthy with it. She's also written Congestive Heart Failure, understanding and addressing the impact on the Black community. Both of these, diabetes and cardiovascular health conditions, are they both are at the top five conditions of health challenges and health conditions that impact our community. Through her writing, Tracy aims to raise awareness, promote health literacy, and empower individuals, particularly within the Black community, to take control of their health and well being. Tracy's multifaceted career trajectory reflects her unwavering dedication to making a positive difference. So she's not just talking it, she's acting upon what she's talking. Tracy's um, diverse skill set, coupled with her passion for serving her community, coupled with her being a proven healthcare professional, partnered with her being an author and a real estate investor, she serves her community, continues to inspire and uplift those around her. So, without further ado, I'm going to go ahead and introduce Miss Tracy Wesley. Please go ahead and put comments in encouraging her on her walk that she's going on now with and through her, through the diabetes and through the cardiovascular as far as public speaking. Please give her as much love as you possibly can, whether you're going to send that love tonight live or whether you're going to send that love after we've actually posted the video up. Tracy, it's all yours.
Hi, it is so nice to be here, and thank you so much, Sandra. It's a pleasure to be here today, just to share insights and strategies for managing diabetes and living a healthier life, a more fulfilling life. As someone who has personally navigated, the challenges of health, but not diabetes, I wrote this book to provide practical advice, inspiration, and to support others that's facing, similar journeys. I'm so excited to share some key takeaways and answer any questions you may have about living well with diabetes. I um I just have a passion for helping the community. I am actually in a space where I am able to evaluate clinical, and I'm able to see readmissions within the hospital settings. I'm able to look at um, the ethnicities of each patient and just to look at the diagnosis. And what I've seen is that our community is really suffering with diabetes, suffering with not having or not being provided the proper information in order to help just to maintain their blood glucose levels, or just to even understand the signs and symptoms of high blood glucose or low blood glucose, or even what we call diabetic ketoacidosis, which is very serious. And we will get into that a little later. Um, just to give you information about diabetes and the different types that we have. So we have pre-diabetes, which you don't have the disease right now. So there is an opportunity for you to actually catch it so that you will not be diagnosed with type 2. And then we have type 1, which is an autoimmune condition where the body's immune attacks and destroys the insulin, the beta cells within the pancreas. So with that type, regular insulin injections are needed for survival, or your oral tablets. With type 1 diabetes, which is the one that's most prevalent in our community, this occurs when the body becomes resistant to insulin, or it doesn't produce enough insulin in order to maintain normal blood sugar levels. It is often associated with lifestyle factors such as obesity, poor physical activity, and a poor diet. So that's why I'm here. And this is why I wrote the book, because I feel that when you go to the doctor's office, maybe you're not asking the correct questions, or maybe you feel inferior, or maybe you don't have that comfortable relationship with your provider. So maybe you're nervous. Maybe you're alone. Maybe you have forgotten what you really wanted to ask the doctor. So I'm here to reinforce and just to give you encouragement to let you know that it's okay to be proactive. It's okay to ask these questions because your provider is human just like you are. You speak to them as if you would speak to a nurse. Do not be intimidated. This is your life. You have to take control of your health. And so, with that being said, I just want to give you a sample of what diabetes can cause. And it can cause neuropathy. And neuropathy is due to poor circulation. And then it will cause you to have problems with your feelings, with your sensation, which and also can cause cardiovascular disease. So if you don't have sensation, you could develop a wound, an infection, and you might not even know that it's there. And it can cause gangrene. Gangrene is very toxic. If it gets into the blood, it can cause death. So I have a sample case where a patient comes in and they have issues with their blood sugar levels. Blood sugar levels over 400. They came in complaining of a deep ache, occasional burning sensation that progressively got worse. And I mean, it took them 2 months to get to go to the hospital to see about it. And this is something that could have been avoided. This patient has type 2 diabetes. This patient also has coronary artery disease and hypertension. So my main goal also is not to just encourage you to be proactive, but to give you ways in which you could help maintain your blood glucose levels. And that is through proper dieting, eating the proper foods. And the proper fruit foods are foods that are not high in sugar. Stay away from your canned drinks, those sugary drinks, the candy, the cakes. And I would tell you to purchase fresh, frozen vegetables. If you can't, if your area in which you live in does not provide the fresh veggies, if you do not have a farmer's market in your area, it's okay to get the frozen fruits. And I always would tell you to stay away from those canned goods because they have preservatives in there. They're stored with all type of ingredients that's high in sodium, maybe high in fructose. So you want to stay away from that. So it's so important to take control of your diet, exercise. If you're smoking, and I know that it's hard to quit, you got to be proactive. You got to cut back. You have to cut back with your alcohol because remember, those alcoholic beverages pertains a lot of sugar, lots of sugar. And I know that it's also important for you to know and understand the different signs and symptoms of hypoglycemia and hyperglycemia, which will cause the nausea and the vomiting. You may also become a little bit disoriented, very thirsty, urinating a lot. Those are important symptoms for you to know. They're very, very important. And then you have symptoms that could cause you to go into the hospital or call 911. And this is your diabetes that can cause ketoacidosis. Um, and these are this is first diagnosed with type 1 diabetes. The reason is when you're initially diagnosed with type 1 diabetes, you no longer have enough insulin in your body to use glucose for energy. Remember, if you are insulin dependent, your body needs injected insulin to function. So if you forget to take your insulin, especially with meals, it can cause you to go into what they call diabetic ketoacidosis. And the way that they would treat that is by replacing fluids, because you would lose a lot of fluids during this time, and you would lose a lot of your electrolytes. So they would replace your electrolytes. They would also give you insulin because it reverses the condition that caused diabetic ketoacidosis. Take medications for they'll give you medications for any underlying issues that's causing you to go into diabetic ketoacidosis. So with the diabetic ketoacidosis, the symptoms are the nausea and the vomiting. You may have abdominal pain, shortness of breath. Your breath may smell fruity, feeling very tired or weak, feeling disoriented or confused, and you would have decreased alertness. So those things are so important. And the issue that we're having today in healthcare is that our community, we're not being treated properly, or a lot of information has been left out. When you go to your doctor's offices, I noticed that they're not educating as much. They're leaving it up to the patient. So therefore, you need to be proactive. And that is my goal. And that is the reason why I am writing these informational booklets so that you could read. They're easy. It's an easy read, easy for you to follow and understand. And then we have the different fruits. A lot of people, I understand, get confused with the different fruits. You have fruits that are very high in blood sugar, and then you have ones that are, kind of low in your blood sugar. And the ones that are pretty much low will be your grapefruit. So it's good to take a half of the grapefruit, your pears, your apricots, apples, oranges, plums, strawberries, your berries. And then the ones that are kind of high would be your pineapples, the grapes, watermelon, the ripe bananas, the mango, the dried fruit. And then we have those fruit juices that I encourage you to stay away from because they are very high in sugar. And it's also really important for you to know where you could find information from if you have questions about your diabetes. And so we have the American Diabetes Association, and we also have the Florida Health website. I live in Florida, so that is the website that you could go on if you live in Florida. And then we call the Florida Blue Foundation. And this program addresses health challenges. It has a lot of resources in order to help with affordable health care. It would give you options of probably your food choices. And so there's a lot of information out there. We just have to do our due diligence, be proactive, and get this information so that we can manage our health. We can manage our diabetes. And remember, food is your medicine. So you're either going to feed your body with good food or you're going to feed your body with bad food. We must not live to eat, but eat to live. And those are my pointers that I have, and that's what I wanted to share on tonight. And I don't know if Sandra, if you have any questions, you could go ahead, or if anyone else has any questions.
I do have some questions, but before I do get to those questions, what I do want to say is I'm not able to see everyone that's in the audience. So if you are in the audience, we do thank you very much for tuning in tonight. Once again, Tracy asked, and out of respect, we don't have her on the camera, but she is, in course, speaking. So I want to take the time to thank you all for allowing us to deliver this information to you in this manner. We have Jay Palmer who says, "So true. We most certainly have to be our own advocates. We have to. In the African American community, it's a must. It is a must that we actually do become our own advocates." So, Tracy, what do you have to say to that statement that we certainly have to be our own advocates?
Yes, we must, because today, an estimated 13% of adults have diabetes, and nearly 1 in 3 are pre diabetic. And that's in our population. So it's time for us to take charge. We must take charge. And I am adamant about sending out this information. And if anyone have any topics on any disease, put it in the chat. Let me know. I'll be happy to do the research and publish another informational guide.
And then we have Sherry Reed, who is an MRI senior subject matter expert in the MRI field. And she says this is so true. She sees this day, and she sees this every day. She's saying it's a loss of limbs part by part due to prolonged treatment and care. So, what do you have to add to that?
And I would say that more and more young adults are actually diagnosed with diabetes. So these statistics will only increase, impacting healthcare if we do not jump on this or do something about it. You know, those with diabetes may experience so many other issues. Diabetes is one of them. So if you can you imagine if you take care of your diet, if you exercise, if you're proactive with what you're eating, if you take the medication, your insulin, do everything or and monitor your blood glucose levels, which is so important. You would not only manage your diabetes, but you can lower your cholesterol levels. You could also help with your cardiovascular disease. You would also help with, if you have high blood pressure, it could help lower your blood pressure. So it would not only, you know, help with your diabetes, but it would help with your other cardiovascular issues or even your kidneys, because diabetes not only affects your limbs, it affects your kidneys, it affects your vision, it affects your neurological systems. So it affects our total everything, all of the systems it affects. So it's so important. It's so important. So I just cannot stress that enough. How
And then
changing your diet, I'm sorry, Sandra, how
that's
changing
okay.
your diet and monitoring your glucose levels, how important that is.
And Jay is also asking, aside from getting our A1Cs checked regularly, are there any other screenings we should request? And if so, at what frequency?
Yes. So there are other things that you can do in order to, it, besides that, you have your eyes. So you need to have your eyes monitored at least yearly. You can also have labs done looking at your kidney function levels. That's important. And you could have that done every 6 months to a year. You could also have, you like you stated, your A1C. Your A1C levels should be less than 5.7. If your A1C levels are over 5.7, you're headed for diabetes. You're diabetic. So all of those labs, monitoring your kidney function, your eyes, going to your doctor, your dental treatment, and also a podiatrist every 6 months to a year. Or you be proactive. When you feel as though something is going on, you're feeling kind of different, something is just not right. You go to your doctor, and you it's nothing wrong with asking them to order labs for you. Do your research as well. Don't allow them to dictate to you when you should have labs. You could also suggest to have labs drawn. Monitor your cholesterol levels.
And that is so very true. I often put myself in, especially when there's subjects that we're talking about, or we have been talking about throughout these past 23 days, into the situation. I use my personal experience because I what I don't want to happen is I don't want anyone to say, "Oh, that was Sandra talking. She just talking. She just, she's just coming up with stuff." Has she really even ever experienced any of this? And I am a diabetic. I've been a diabetic for the past 20 something years. I found out I was diabetic accidentally because I had a retina condition develop. And the only way that I would be able to, that they told me the only way that I would have the retina detachment is I was diabetic, even though I was, so for certain I wasn't. But I was. So this is a lived experience for me. And so I have to speak up because I know what it is to be a diabetic. I've been there. I know for a very, very long time, my sugar levels had kept rising. Like I was in maybe the eights and the nines a couple of times, which at that time, once it gets to that level, it's called uncontrollable diabetes. There were various reasons why I was at that point in time. I had three deaths in my family back to back to back. My stress level was through the roof. I really wasn't paying attention to what I was eating. I could care less, but to really be honest with you, I could care less about what I was eating. And because I could care less, the foods that I put into my body actually told me and made me stop because everything had started. I started swelling uncontrollably. I started getting sick. I started having headaches. You name it, I went through it. So as a diabetic, one of the things that I have to be mindful of, and that I encourage other people who I meet that are also diabetics to be careful about, is that stress level, that mental issue plays havoc on you if you have diabetes. It just has a havoc. It's one of those things that rank havoc on you. At the time that my sugars were uncontrollable, I also had neuropathy. I had neuropathy in my feet. Some people can get it in their hands and different parts of their bodies. I had neuropathy in my feet. I literally couldn't walk. So the fact that you see me here today and me as, passionate as I am towards healthcare, I'm a miracle. I'll be the first person to tell you I'm a miracle. The things that I've lived through and the things that, challenged me, I'm a miracle. But I had to make it up in my mind. Does this miracle want to live or does she want to die? Knowing that you only get one life, I had to get it together and I had to do better. So this I'm talking to people who might have diabetes or who are struggling with, diabetes and, are just really not taking care of themselves. If you don't take care of yourself, diabetes is going to take care of you.
Ooh, you
it's,
said it.
it's that
Yes.
simple. You don't take care of yourself, diabetes is going to take care of you. It is going to wreak havoc on you, on your body, on your mind. It's a mental issue. I'm often asked by my endocrinologist, how is my mental state? Are you depressed? Are you going through anxiety? What's going on? It took me, I was fortunate enough and blessed enough to actually add to my medical team a functional medicine doctor who I simply adore. I adore her because not only is she a functional medicine doctor and not only is she a functional medicine doctor, but she's also a licensed pharmacologist. So she has it from both ends. She knows about it from both ends, and so she's able to treat me in such a manner as I've actually gotten help from it. So I'm just giving hope and promise to those who might be diabetic and just like really struggling and not knowing where to go for help. One of the things that you spoke about, Tracy, this evening was fruits. When I went to my nephrologist, well, not my nephrologist, because my kidneys are messed up now too, which is a side effect from, I'm saying, from the metformin that they had me on for all these years, as well as now the doctors haven't told me that, but I honestly believe that that's what has actually led up to my kidney function problems is the fact that I've been on metformin for all those years. But my functional medicine doctor, she gave me a list of foods that I should eat, and I looked at that list, and I was like, pineapples. I can't have pineapples. I was drinking, everyone. I would drink faithfully every day. What I called the most healthiest drink there was, which was a pina colada smoothie in the morning with yogurt. She said,
Mm.
your body can't have pineapple. I was like, but it's a fruit, and I'm being told to eat fruits. She said, yeah, but you can't have all fruits. So that speaks to you, Tracy, and what you said. There are some things that are high, they say are good for you. Fruit's good for you, but not all fruits and not for all people. So we have to be mindful of that and ask your doctor, can I have this? Is this recommended for me? If not, what should I replace this with? I've replaced my pineapple smoothies with berries. I have berries all the time, every day. But so it took some changing for me to go through, but I was actually able to go through it. So Tracy, I'm so thankful that you brought up the fact that you have to be even sugars. You got to be careful with sugars, and you brought up fruit punch and said how much sugar's in fruit punch. Well, we already know we're drinking fruit punch, even if we're drinking natural fruit punch, right? We're not sure about what kind of fruits are in there, that we're taking a risk with drinking fruit punch because all fruits already have sugar in it. How much sugar? Depends on what kind of fruit juice you do. It's neither here nor there. So I'm thankful for you that you brought that up and that you mentioned to people that you fruit juices are bad for you, sugars are bad for you. Not all fruit is good for you because there's plenty of people that are like me, eating fruit thinking that, oh, I'm eating some fruit, this is good. But the same thing for vegetables. Some vegetables I was told that I shouldn't have. So are there vegetables in that line of what you can have and what you can't have, or you shouldn't have as far as diabetes is concerned?
Now, the veggies that, you do have some starches that are considered vegetables. So you have to be really careful. And when you're going and looking for vegetables, you have to make sure that this is not a veggie that's high in starch. So that's important also, because you know that once the starches are digested, it can turn into sugar, and it can cause uh, your blood glucose to be elevated within your bloodstream. So you have to be very careful with that. Some of the healthier foods, um, you have your collards, you have your kale is good, um, and you have tomatoes, salmon. Tomato is considered a fruit, and some people consider it a fruit. Some people consider it a veggie. But tomatoes are good as well. So there are, and then you have your Brussels sprouts, cabbage. Those are very good. And like I said, not just for diabetics, but for people that's suffering from cardiovascular disease, heart disease, hypertension. You can get rid of this, or you can maintain it, or you could, you know, have it under control just by what you're eating, what you're putting in your mouth. And I was like you, Sandra, I love pineapples. I'm not a diabetic, but it was a lot of sugar for me and I couldn't handle it. I didn't realize, I knew that pineapples, they were good, a good fruit, but I didn't realize that they were one of the fruits that was very high in sugar. So you have to be very careful with that, especially when you are a very sensitive diabetic. And those diabetics that, I mean, their blood sugar fluctuates. Blood sugar can be 40 and then skyrocketed up to 320. So those are very sensitive diabetics must be very careful. You know, diabetes, it damages your blood vessels. It's just inadequate or poor blood flow. So if you are eating those foods also that's high in cholesterol, all your fatty foods, you're clogging up your arteries as well. So then your blood and the oxygen is not really getting to those vital organs in your body or your tissues. And just, food is your medicine. I know that we are prescribed medications, but you also know that those medications have a lot of side effects. Sandra was just saying that she believes that her metformin could have had an effect on her kidneys. A lot of these medications, they have a lot of side effects. So that's why we need to be proactive and start eating right, exercising. It's hard, I know. But what I realized, Sandra, is that we're so used to tasting sugar or salt. Do we really truly know what our foods taste like? Because we put so much sodium, so much sugar. That's what we're tasting. That's what you're addicted to. It's not the food because you don't even taste the food because it's saturated in all those toxins. That's another subject. And for our community, our community, and it's just unfortunate that a lot of people from the Black community, they do not have access to those farmers markets, or they might cannot afford to pay for or afford fruits because fruit can be expensive. The foods that are good for us, they are expensive, but there are ways around it. If you can't afford the fresh fruit, go into the frozen area. Stay away from those canned goods.
And as you say, stay away from the canned goods. I know why you're saying stay away from the canned goods, but there are people that will be looking at this and they will be like, well, why should I stay away from the canned foods? So, can you summarize why you should be staying away from canned vegetables, canned fruits? Can you share a little bit, please?
Because when you always look at your ingredients. Those canned foods are packed with a lot of preservatives. And the preservatives are packed so that the foods can last longer. And they are not natural. And they may be packed with a lot of sodium, or they may be packed with a lot of sugar. And I also say that for those who can only afford the canned goods, if you're eating black beans, I would say take it out of the can and just rinse them off. We have to find other ways to be healthy, or just find another way. Don't continue to do something that is not causing you to have a good health outcome. Find a different way to stay out of the hospital.
And that is so very true. It goes back to the fact that we can do better, and it's up to each and every one of us to do better. It's up to us to do better for ourselves, but at the same time, if we know someone who is doing, eating horribly, or we can, see that they're headed down that path of, hey, look, you need to, you're saying to yourself, like, why are they eating all like that's not good for them. Don't come out and lambaste them and, hey, you're going to be diabetic or da 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 da. I mean, no, don't talk to them like that, but encourage them in a positive way. Say, hey, have you tried this? Or, fix something for them just out of the blue. Fix something for them that is healthy. You don't have to tell them it's healthy. Just fix, that you changed an ingredient in it because it's a health benefit. Just change it up, give it to them. They like it, right? And they ask for some more. Can you give me that recipe? They'll be shocked to know that you actually changed this up for something without them even realizing what the difference is. But, whatever you do, whatever we do, we need to continue to, you know, empower and engage patients, not just in the African American community, but in all communities. We need to engage each other to be better, to do better, to walk with them down that lonely road of I gotta change my diet. I can't keep doing this, or I can't keep doing that. Help them to measure things out so that even the foods that they like to eat and they eat, they can still eat them, just eat them at a measurable rate where they're not overdoing it, right? So those are some of the takeaways that we wanted to have with you. Tracy will actually be back because in March, the Charms Many House Foundation, in honor of International Women's Month, will be bringing forth an International Women's Day event. It will not be all 30 days. It will, however, be right now, I'm looking at 15 of those 30 days, but each person will be talking to us in the same manner as which we are hearing this month, which is this is how we do this. This is how we get to the point of where we're living healthier. We're living in cleaner communities. We're living in healthier communities. We've got to stop the issue of expecting for people to, do for us when we can do for ourselves. Those of us in the African American community that can continue to encourage and empower and engage our community, we got to step up. We can't keep falling down on a job. We've got to step up and we've got to show people, not just talk. Talk is cheap. I don't care what color you are. But as far as our African American community, let's raise the mantle. Let's stop talking and let's get to work in these some of these communities that need the assistance, and some of the people that need the assistance. Let's step up and give it to them. Right? That's what our ancestors wanted from us. They wanted us to get to the stage where we now have social media, where there's no reason for us not to be able to speak to people on terms that they understand, or with the passion and with the embrace that we need for them to understand what's going on. We've got to stop talking. We have to start doing. Absolutely no one is coming by in a boat or on a bus to save us. It's up to us, right? So we've got to get past that point. So Tracy will be one. She will be one of our recognized panelists, speakers during the month of March. Stay tuned for more information and please join with us. And if you are a man and you have a story to tell, or you have a story to share, and you're listening to this video, please reach out to me, because we would love to spread some of this love that we have here to this month, that we're going to have in March with the women. When June rolls around and it is Men's Health Month, we would love to have the men step up and talk to the men about the importance of their health and how they can maintain their health, so that they're here for not only themselves, but they're here for their children, their wives, and their community. So please, if you know someone that might be a good speaker, or that is a good speaker, or you yourself have a great topic that you want to share with the men, and we women will be supporting you. So we will be here supporting you. Please let me know so that I can go ahead and set those rooms up, so that I'll know who is available and get in touch with you to set up some dates and some times. But before we go, Tracy, what I do want to ask you, and I know you spoke tonight on diabetes, and I'm so thankful that you spoke on diabetes, and you gave us some good information in reference to the medication, as far as the medication can have side effects, as far as the neuropathy and the other conditions that, the vision care that you spoke about, which I had the neuropathy, I had the vision issues, all of the things that you mentioned tonight was a part of my life for at least 5 or 6 years. It recently changed over the last month. Well, not the last 6 months, since I've introduced the functional medicine doctor onto my medical team. It's changed where my sugar right now is actually at a 6. It went up slightly when my mom passed, but it's at a 6, so it's on its way down. So I'm glad about that, and I'm very, very blessed to know that God has got me to the point where I see now. Like my doctor, I told my doctor, I was like, "You broken down and told me what it is I should eat and what it is I shouldn't eat, and you told me why I shouldn't eat it and why I should eat it." So people that have someone diabetic in their family, or if you're diabetic, ask your doctor that question, and then push them to explain to you why you shouldn't have something. Because you telling me I can't have this or I shouldn't have that. What I was doing was running out and getting it, because you told me I couldn't have it. Right? I didn't have no reason to not eat or drink those things, right? Because you wasn't telling me enough. But in someone telling me and showing me, I got the picture. And so because I got the picture, I was better for it. I do have one additional question, and then I'm going to go ahead and ask you for your final comments, and that is this. You spoke about health literacy earlier, and can you tell for those of those who are listening that are not health literate, what is the difference between you as a diabetic? What is the difference between you having an endocrinologist on your team and you having a regular medical doctor?
So the endocrinologist is the specialist. He's the specialist that has put in that study with about your pancreas, how the body works when it comes to diabetes. And I did go over a little bit of what type 1 diabetes is. That endocrinologist understands that type 1 diabetes is an autoimmune disease. So the endocrinologist, that's his specialty. That is the person that you would go to in order to help you to maintain your blood glucose levels. Not so much of your primary care doctor. A lot of times, the primary care doctor would be the one to discover that you may be a type 2 diabetic or you may be a type 1 diabetic. But then they would refer you to the endocrinologist, who is the actual specialist that deals with diabetes.
And thank you for that. And the reason why I asked you to bring that subject up is because I actually did a conference this year, a patient centered conference, because I was interested in gathering data on what the patients knew and whether what we as healthcare professionals talked about, whether it was important to them to know. And what I walked away, the data I walked away from was a lot of the things that we're talking about. Patients don't really care about that. They want to know what they need to know to get better. So when I asked them what kind of doctor would you go to for asthma or for your for your lungs none of them knew that none of them knew, none of the attendees knew the importance of the IST at the end. So when they walked out of there, after I explained it to them and they walked out of the conference, they was like, "Oh, thank you, Sandra, so much, because we didn't know." And I'm like, "Well, when you go to your doctor, what is your doctor telling you? When they tell you that you have asthma, or they tell you telling them you having a problem with your heart, what are they telling you?" And the attendees in the conference was like, "Well, they ain't telling us to go see nobody with no IST. They ain't telling us to do none of that. You just told us tonight." So I'm saying this for this reason. It's not that your medical doctors are not any good. I love my primary care doctor. I think she's excellent. She is the bomb, as they say, and that might be an old sentence, an old statement, but she is. She's just that good. But she's not a specialist. So if you're having a problem, a health condition, and your doctor has diagnosed you with that condition, you as a patient should ask that particular medical doctor, that primary care doctor, that medical doctor, what kind of specialist can I go to that would better understand my condition? And have them tell you. And if you don't know, if they don't know, or they say, "Well, I don't really think you need one," call me or send me a DM, send me a message. Sandra, this is what they say I have. What kind of specialist do I need to see? Because in my opinion, you need to see your specialist. Your primary care doctor and your specialist should be monitoring your health status together, but you as a patient need to go ahead and add a specialist to your care. And I did say that we were going to close out. So Tracy, and thank you everyone for showing up. If you want to know more about Tracy, or if you want to, reach out to her and have her come and talk to your organization, if you want a copy of this link, please reach out to me. But Tracy, where can they go to find your book? How do they get in touch with you?
You can go on Amazon. Amazon has it, the Kindle version as well. You could reach out to me. My email address is T as in Tracy, RAI as in I64 at Comcast.net. And it's my mission here is to encourage, uplift, and empower people to just take control, take control of your health issues, particularly with diabetes. One of the best feelings in the world is just knowing that, you know, I have helped to educate the community. People with diabetes, they requires not only drug therapy and blood glucose control, but they also need to understand that a healthy lifestyle change is very important. Dealing with diabetes uh, has a psychological impact as well. And just like Sandra stated, stress. Stress can cause your blood sugar to just get out of control. Stress can cause you to become sick, period. So maintaining your stress levels, changing your lifestyle, that's going to be key. And educate, educate, educate. I cannot emphasize that enough. And it's been a pleasure to sit here on this platform to speak with you all. And I thank you for having me, Sandra.
No, no problem at all. And as we close out this evening, remember diabetes is not a condition for African Americans slash blacks. Diabetes impacts and affects all different cultures. So we are all in this together. We all might not be diabetics, but we are all in this together, regardless of your race or your color, your culture. We are all in this together. And if each one of us would take what I love to do and do it themselves, we will all make a difference. And that is each one, teach one, reach one. Or if you want to say each one, reach one, teach one, whichever way you do it, let's continue to play it forward so that we, the healthcare heroes, and we, the patient community, as a matter of fact, all of the players in the healthcare role, all of the stakeholders, we can make this better. We can make it better, and we can make it sustainable and better at the same time. So with that, please have the rest of a great day, no matter what time you're watching this. And please know, again, if you have any comments, if you're on LinkedIn, you have comments, please go ahead and add them. If I didn't get to them, I will address them with Tracy and she will be able to answer them. If you're watching on Facebook, the same thing. Send me a DM. Say, Sandra, I want to, some more information, or we'd like to have her talk to our organization. How can we get a hold of her? Just let me know. By all means, this is about collaboration. Collaboration is key. Working it alone, we ain't gonna do it. Collaborating, we will do it. So with that being said, have the rest of a good day, whatever time of day you are watching this. Thank you so much. And tomorrow, which is February 24th, we will have Women After the Storm. Another heated discussion coming up tomorrow. Tomorrow's event time will be 6 p.m. Central Standard Time. So please tune in for tomorrow as well. Thank you so much and have a great day.